anyway, I'm the head of medicine for about a year in Regina, and so this is looking at the medical issues around transfers or handovers. So complex patients are in internal medicine. A safe handover requires information to get transmitted. The discharge summary is how you do that. And by the way, that's also a provincial priority, discharge summaries and medication discharge reconciliation. So what we did was to, first of all, start with looking what there is, and I personally reviewed all the discharges from internal medicine for a week and documented quality. Was happy with the quality, actually, but the issue was timing of when the discharges were made. So we had some iterations in terms of how we looked at it in larger groups over time, the PDSA cycles for the data collection. And then we focused in using some of the things we learned here in terms of a run chart. So you can see this is a run chart, and the important things are that it's January to September when we last collected the information. Group 1 contributes 80% of the errors, so discharging dictating anything later than the day of discharge is a defect. And so Group 1, 80% is defect. Group 2 is good 20%. And this one is the report pointing to a particular position in the cohort of internal medicine. So you can see that particular position had quite a bit of variability. Haven't figured out why yet. So here is the group. So you can see in Group 1 there was a lot of variability. This is the report that I'm intending to be sending to the physician who had that way out of line. These are your discharge summaries that you didn't do. Please do them right now. So opportunities, data for discharge, dates. That was really hard to find. That was one of the learnings. It's hard to actually get the data from the system to be able to send these report cards. One of the concepts in the Pareto principle is, the 80-20 rule. So we looked at the 20, I can do that. So the 1 minute left. So 80% of the worst, so we're going to flip it around, and in fact, the one you saw was the single physician who represented 20% of the worst performing. So interesting. The information capture is where we spend our PDSAs. We haven't actually sent feedback. That's the next step. We're looking at automating the data gathering so we can replicate in other departments. We need to work with the physicians, and I'm done.